In 2020, something didn't add up. When fear replaced common sense and critical thinking, and protocols stopped matching what we were seeing, a lot of us started asking questions. And once you start digging, once you start researching, you can't unsee it. Welcome to Nurses Out Loud. I'm Jody O'Malley, ER nurse and nursing ethics educator. And this is where we talk truth, patient rights, and real-world healthcare so you can make informed decisions and advocate with confidence. If you've been looking for your people, here we are. If this resonates, if you find yourself nodding along, please like, follow, and share this show with at least one person who needs it. And if this episode offers continuing education credit, check the show notes for learning objectives, disclosures, and exactly how to earn your certificate. This episode of Nurses Out Loud is sponsored by West Cocoa Pharmacy in Cocoa, Florida. If you've been looking for a pharmacy that thinks outside the one-size-fits-all box, West Cocoa Pharmacy partners with licensed prescribers to create individualized prescription-only compounded medications. That includes ivermectin, benbendazole, fenbendazole, and other repurposed drugs, alike low-dose naltrexone, methylene blue, bioidentical hormone replacement therapy, custom erectile dysfunction combinations for men, and carefully selected supplements. They also support integrative oncology care, offering compounded medications that some physicians use in alternative cancer protocols. One of my favorite parts is their free consult with Nurse Donna. She's there to provide education on evolving repurposed therapies and HRT, so you can ask better questions and have a more informed conversation with your own clinician. As always, this is not medical advice. I'm not telling you what to take. I'm pointing you to resources. Any medication or protocol should be decided between you and a licensed provider who knows your history. To learn more, visit Cocoa Pharmacy, COCOA Pharmacy.com. That's Cocoa Pharmacy, COCOA Pharmacy.com, and let them know you heard about them on Nurses Out Loud. Mask mandates are back, so are the receipts. Arizona, here we go again. Banner Health is implementing mandatory masking for patients, visitors, and staff in patient care areas. And they started this on New Year's Day, citing a seasonal flu surge. If you feel like we just traveled back to 2020, you're not crazy. But here's what matters. Mask mandates weren't defeated because of politics. They were defeated because the legal and scientific record collapsed under scrutiny. And one of the most practical, plain English resources I've seen, written by an industrial hygienist, in case you don't know who that is, that's the actual profession trained in exposure control. They are exposure scientists, written by Tyson Gabriel. He wrote an amicus brief, written with two other industrial hygienists in Wall versus TSA. I'm going to put the brief in the show notes so you can actually read it. But this brief lays out something public health messaging consistently skipped. If you're going to talk about safety, you must use the hierarchy of controls. Industrial hygienists don't guess at mitigation. They use a long-established framework called the hierarchy of controls, prioritizing what actually reduces exposure without relying on perfect human behavior. That's the key point in Tyson's brief. Engineering controls isolate people from hazards, ventilation, filtration, airflow. Administrative controls depend on consistent procedural compliance. PPE sits at the bottom. PPE is at the bottom because it relies heavily on human behavior, comfort, training, myths, and consistent use, those types of things. The brief argues that universal masking policies leaned hard on the weakest rung of the ladder and then called it science. Mask is not the same thing as respirator, and workplaces have rules. One section I want every nurse and every hospital administrator to read. The brief describes how even healthcare settings demonstrated widespread and proper use of respirators in the pandemic, including lack of fit testing, correct strap use, and practices that break the seal. And it draws a bright line between surgical mask, which is no seal and a limited scope, versus N95 respirators, a respirator that depends on correct use and a seal. It also points out that transportation hubs and, by extension, workplaces aren't exempt from workplace safety standards, highlighting OSHA's regulatory frameworks like 29 CFR 1910.132 and 29 CFR 1910.134. And here's the part the hospitals need to hear. When institutions mandate respiratory devices, they cannot hand wave away the requirements tied to a medical evaluation and safe use standards for respirators. That's why we get fit tested on them every year. This is also a watch it, don't just read it moment. Tyson created a video documentary series walking through deficiencies he believes exist in masking experiments and policy claims so people can understand how narratives were built and why the courts pushed back. If you're trying to educate a friend, a coworker, or a hospital decision maker, this video can land where PDFs don't. So what to do with this? I want you to send this to the hospitals. If you are looking at this or listening to this on podcast, guys, you can also follow nursesoutloud.substack.com and you can get drops on the show. You can also support Nurses Out Loud by becoming a monthly subscriber, $5, $10, whatever you decide. But I would really appreciate you looking into that. We've been on air now for 4 years, and this is just a new journey. So what to do with this? Okay, if you want to send something useful, here's the practical move. Send a short, calm email to leadership. I'm going to give you the template below. Attach the amicus brief. Include the documentary link. And ask for the facility's exposure control rationale using hierarchy of controls, not vibes. Okay. Copy and paste that email in your template. So basically, for the subject, you're going to say request for exposure control rationale, hierarchy of controls. It's the same, nurses. A lot of people, it's hard, like why we're such good advocates is because we understand the language of medicine. Well, here is one discipline that we don't really understand because we were never taught. And that's the industrial hygienist. So when you speak to whoever's in charge, whoever you send this to, and you could start at your supervisor or your manager, you could start there, or copy in administration, the CNO, et cetera. But when you start saying hierarchy of controls, they're going to be like, oh, this nurse knows something, or this person knows something. Because I know it's not just nurses that listen to Nurses Out Loud. Thank you. Thank you for your support and your confidence. So it'll say, hello, whoever the name is. I'm writing regarding the reinstated masking requirement. Banner's public messaging attributes the policy to seasonal flu activity. As a healthcare worker, community member, I'm requesting the facility's documented exposure control rationale using the hierarchy of controls, engineering, administrative, PPE, including what engineering controls were evaluated: ventilation, filtration, air changes, airflow. What administrative controls were evaluated: sick policies, staffing practices, triage flow. If PPE is mandated, what specific standards and training protocols are being followed for appropriate use? For reference, attached is an amicus brief authored by industrial hygiene experts that explains the hierarchy of controls approach and raises concerns about policies that rely primarily on face coverings without adequate prioritization of controls. Thank you for responding in writing. Respectfully, your name and your role. Ever felt torn between your conscience and your job? You're not alone. It's time for nurses to rise, to lead with integrity, grit, and faith. Earn CEUs that teach you how to stand firm in truth and advocate without fear at righteousrn.com. That's righteousrn.com. Protect your license, your integrity, and your peace. Because, guys, personal protection isn't only about what's on your face, okay? Let me say this plainly. If you can reduce pathogen burden where many respiratory infections start, the nose and mouth, that's worth paying attention to, right? Well, that's why I've used dilute povidone iodine approaches since 2021 and why I personally use Immune Mist. Although this isn't some fringe idea, intranasal povidone iodine has been used in pre-op settings for nasal decolonization as part of strategies aimed at reducing surgical site infections. Now, this is a different context than community respiratory viruses, but it shows the mainstream clinical use of the concept. And what does the broader science say? There's published work showing rapid virucidal activity in vitro for povidone iodine against coronaviruses. There are also clinical studies exploring whether povidone iodine nasal oral protocols can reduce viral load or detectability. Results and real-world relevance vary by protocol and setting. Some papers have framed certain iodine irrigation concepts as hypotheses that still need robust clinical validation before broad adoption. But here's the thing, guys. It's like, it's kind of like with ivermectin. If you're listening to this and you know somebody who tried it or you tried it yourself, we didn't need some long, double-blind, placebo-controlled trial study to tell us it works, because we knew it was working and we knew what the risk versus benefit was, right? We owned our autonomy and we were informed in our decision making. And again, risk versus benefit matters a lot. And these medications were very low risk medications that have been around for 40 years, got the Nobel Peace Prize. All right. So we don't need to have all of those. But my stance is this: if you're going to do something, quote unquote, choose interventions grounded in plausible mechanisms and real literature, then use them responsibly. And it's important to say that this is not medical advice. If you have an iodine allergy, thyroid disease, are pregnant, breastfeeding, or have questions about safety, check with your clinician and follow the product label. If you want Immune Mist, you just go to immunemist.com/RNJODI, JODI. And if you use the code RNJODI, JODI, you will get a discount. And if you want to help me spread the word, comment MIST, and I'll send you the link comment team, and I'll send you the link to join my team and help me get this information out. I tell you guys, I've been sharing this for years and people just absolutely love it, including myself. So that's all I have for you today, friends. Just remember, nursing and ethics matter. And when you understand the code, you understand what your role truly is. I say this all the time, and I'm going to say it again. The Bible guides believers like the code of ethics should guide the nurse. Thank you for listening to Nurses Out Loud. Nurses are called by our code of ethics to keep learning, do the research, and lead with moral courage and integrity, especially as healthcare changes. Keep doing the next right thing, especially when it's hard. If this show resonated with you, please like, share, and follow. It boosts us up in the algorithm so more people can find us. Until next time, friends, be safe, be well, and God bless. And if this episode offers continuing education credit, check the show notes for the learning objectives, disclosures, and exactly how to earn your certificate.